Hi, my name is Jennifer Jones, and I'm going to give a teaching presentation on stroke. The presentation I'm going to give is going to be geared towards teaching nurses, emergency room nurses, that are going to be triaging patients. There are going to be patients that are presenting with new onset stroke symptoms. Stroke is the 5th leading cause of death in the United States, and early detection of stroke is key to lowering the risk of deficits associated with stroke. So it's extremely important that when patients are presenting in the emergency room, that nurses are able to identify and follow the plan at hand in order to lessen the possible side effects. So first I'm going to start with just an instruction and discussion. I'm going to use this chart, which is just going to list the different types of stroke, and then it's going to also have the associated signs and symptoms with each type of stroke. Following this lesson, I'm going to sit down with the class, and it's going to be a discussion setting. We're going to I'm going to give numerous case studies of patients presenting to the emergency room and with different signs and symptoms, and then the class is going to discuss and talk about what type of stroke they believe the patient may have. The first type of stroke I'm going to talk about is left hemisphere. When the left hemisphere of the brain is affected, that usually cause right visual field deficits, right-sided weakness, and sensory loss. And they're also going to have a left gaze preference, which means their gaze is going to go towards the left-hand side, actually the side where the stroke occurred. In a right hemisphere stroke, there's going to be left inattention. That actually means that they're going to completely ignore the left side of their body. You'll notice if they brush their teeth, they may not brush the left side. If they are eating a plate of food, they will only eat the right side of the plate, and they don't even notice the left side. They can't see it. They don't even know that it's there. It's also going to include left visual field deficits, left-sided weakness and sensory loss, and a right gaze preference. In a cerebellum stroke, there's going to be discoordination and imbalance with a wide-based gait. A stroke that occurs in the brainstem is actually going to present as cross signs, which means if the right side of their face is affected, it can be the left side of their body is affected. So you may see a right-sided facial droop, but then left-sided weakness. There's also going to be associated paresis and sensory loss in all 4 limbs. Decreased level of consciousness, ringing in the ears, dizziness, vomiting, and dysphagia. It's extremely important to keep any patient that comes in with stroke-like symptoms NPO until they have determined that the patient is able to handle any secretions or any type of liquid so that they don't aspirate. Next is going to be a hemorrhagic stroke. The signs and symptoms of this are very similar to an ischemic stroke depending on the location in the brain where it's occurred. It's also associated with headache, nausea and vomiting, and a decreased level of consciousness. And a subarachnoid hemorrhage is going to be associated with an intolerance to light, a very severe headache, neck stiffness, and nausea and vomiting. So once you have determined the type of stroke that it is, you can kind of move on to the next phase. So after this part of the presentation, then I'm going to move on to a demonstration. I'm going to demonstrate how to perform a MEND exam. This is extremely important for emergency room nurses to do. It will kind of give you a heads up if they're experiencing any signs or symptoms of stroke. So I'm going to demonstrate on my husband, Mike. Following the lesson, I'm going to ask the class to do a return demonstration so that I can see that they understand. So I'll start. Can you give me your name?
Michael Jones.
Your date of birth?
12/25/79.
Okay, and can you, where were you born?
I was born in the Philippines.
Can you please tell me, can you repeat the sentence after me? You can't teach an old dog new tricks.
You can't teach an old dog new tricks.
Okay, can you smile? And raise your eyebrows. Okay, now I want you to look at my finger, and I want you to follow my finger without moving your head. Okay, and now I'm going to check all 4 visual fields. So I'm going to hold up my fingers, and I want you to tell me how many fingers I'm holding up.
2, 2, 3, 1.
Next, I'm going to put my finger right here. I want you to take your finger and touch your nose and then touch my finger and go back and forth. Okay? I want you to take your shin of one leg, or I'm sorry, your heel of one leg and slide it down your shin of the other. And I want you to do that with both legs. Okay? And the other leg. All right? Next, I want you to put your arms out, your palms facing up, and I want you to hold it for 5 seconds. 1, 2, 3, 4, 5. Okay, you can put it down. Next, I want you to do the same with your legs. Put your legs out, hold it up for 5 seconds. 1, 2, 3, 4, 5. Okay, you can put your legs down. Now I want you to close your eyes, and I want you to tell me where I'm touching you.
Right arm. Left shin. Left arm. Right shin.
Okay, that's it. Thank you very much. So that's how you perform a MEND exam. Every part of the MEND exam has a specific purpose. The things that you're looking for when performing a MEND exam, for example, when you're asking them to repeat the sentence, you want to pick a very simple sentence. The sentence "can't teach an old dog new tricks" is actually a sentence that's quite common to use. It's because it uses all muscles in the mouth. If they cannot repeat simple words, that could be a sign or a symptom associated with a stroke. You want to make sure that they know their name, date of birth, obviously, that they can respond to commands, smile, raise your eyebrows. You're going to look for any type of facial droop. You're going to check their visual fields, and that's what I did with the fingers on the side. Motor function, it's important when you're checking their arms because people are known to fake things sometimes when they go into the emergency room. Make sure that they have their palms up when you have them hold their arms out, because if somebody's faking it and their arm starts drifting down, they're naturally going to turn in like that. So if they're turning in like that, that means that they, or if they don't, I should say if they don't turn in like that, if they just drop it like this, that means that they're probably faking. So you want to make sure that their palms are up when you're performing that exam. And then as far as their coordination goes, with the finger to nose, you want to make sure that the movement is smooth and consistent, that it's not real choppy or real shaky. The same with the shin and the leg. So again, once I go through this lesson, I'm going to ask the class to demonstrate a MEND exam on their peers in the class. And then I will move on to the next part of the presentation. The next part is going to consist of PowerPoint slides, and it's going to pretty much go over what the steps to take if a patient does present in the emergency room with new onset stroke symptoms, because there are several things that we need to do, because there is a short period of time in which a person is diagnosed with a stroke or starts having symptoms, and then in which we can deliver TPA. It used to be a thing that TPA had to be delivered within 2 hours. They've actually extended it to 4.5 hours, but that is only for specific eligible patients. The national goal is actually in less than 60 minutes from the time that they are experiencing symptoms to the time that they are actually being administered the first bolus of TPA. So if a patient presents to the emergency room with new onset stroke symptoms, the triage nurse is going to assess the patient and perform a MEND exam. Then the emergency room physician is going to evaluate the patient within 10 minutes of arrival. If they are determining that the patient is having a stroke alert is going to be initiated. CT and lab are notified of the stroke alert, and a stroke power plan is ordered. The power plan that is ordered is going to have all the attached necessities, such as the lab work. Lab work is going to consist of a PT, PTT, INR, Chem7, CDC. We're really going to want to check like their clotting factors, especially we want to make sure to see if they're a candidate for TPA, because as we know, TPA is extremely dangerous. We don't want them to end up bleeding out. We also need to have a CT done. We need to determine if the stroke that they're having is actually a hemorrhage in their brain, and if they're hemorrhaging and bleeding in their brain, they obviously are not going to be a candidate for TPA, and then we're going to need to take a different route with our treatment. Another important point to note is that the blood work that is drawn is actually walked to the lab instead of put into a tubing system. Because there is such a small time frame that we are given in order to administer the TPA, it is extremely important that things are done efficiently, and we don't want to run the risk of something being lost in the tubing system. If the patient has been, if the workup's complete and the patient has been decided to be a candidate for TPA, the patient is going to be transferred to the ICU, and the bolus of TPA is going to be given. And again, the national goal for this is going to be less than or equal to 60 minutes from the first onset of stroke symptoms. It may be given in up to 4.5 hours in some eligible patients after the onset of symptoms. We're also going to provide supportive care in the ICU. Oxygen should be administered to keep O2 saturation greater than 95%. 2 IV lines need to be placed, preferably an 18 gauge. TPA is going to run by itself. It should not run in a line with anything else. Elevated blood pressure should actually remain untreated for the next 24 hours. If somebody's having a stroke, we don't want to lower their blood pressure. Even if it's high, we don't want to lower it too much, because we need them. They're actually suffering from a loss of blood to the brain, and we need to, we don't want to run the risk of lowering that blood pressure and them getting even less blood to the brain. Now, if the blood pressure is over 185 systolic, then we may consider treating it, but that's a doctor's decision. 12-lead ECG is applied, and this may reveal the etiology of the stroke because it could be associated with an MI. Now, if the patient has been determined not to be a candidate for TPA, workup's complete, they're not a candidate for TPA, we're going to look at the CT. If it was negative for bleed, the patient's still going to be admitted to the hospital, and we're just going to provide the supportive care measures that I just went over. We're going to continue neuro checks, possibly every hour for the next 24 hours, possibly every 2 hours. Just keep an eye on the patient, make sure nothing else develops. If the CT is positive for a bleed, then we're going to consult neurosurgery for a further course of treatment. Once I have gone through all the PowerPoints with the class and we've discussed everything, I'm actually, well, I should say before I even did that, I was going to administer a pre-test to kind of see where everybody is and their understanding of stroke and how to assess and determine if somebody's having a stroke. Following the PowerPoint presentation, I'm going to administer another post-test to kind of see if they've learned something and see where they're still lacking in knowledge. And then the final part of the presentation is just going to consist of discussion. It's just going to be an open discussion. Everybody's going to be given a worksheet. These worksheets are pretty much just going to be blank. It's going to be people writing down, the classmates writing down their concerns on what barriers they feel are present in treating stroke patients in the hospital. And then once the presentation is completely finished, it should take a course of approximately 3.5 hours. I'm going to give out a questionnaire. It's just to evaluate how the presentation was and if things were learned. The questions that I'm going to include on this evaluation are, was the information provided in a clear and concise manner? Were the handouts informative and useful? Did you find the information useful in regards to how you treat and assess patients in the future? What part of the class do you feel was the most beneficial? What part of the class do you feel was the least beneficial? And then last, what changes would you recommend be made in future classes? And then I would use these evaluation forms in order to modify and enhance the class in whatever way I felt necessary in order to make it a better learning experience for everyone involved. So thank you for listening. Again, my name is Jennifer Jones, and thank you for your time.